An example of hematopoietic growth factor is erythropoietin. Tissue plasminogen activator that disperses blood clots is beneficial if it is given within 3 hours. Anticoagulant action both in vitro and in vivo is seen with heparin, which anticoagulant impart orange color to urine, that is phenylenedione. Which statins show highest LDL cholesterol lowering efficacy and has additional antioxidant property, that is atorvastatin. Most commonly used dextran as plasma expander is dextran 70. Dipyridamole, which is vasodilator used to enhance the antiplatelet action of aspirin. Epsilon aminocaproic acid is a antifibrinolytic. Which of the following anticoagulant used during pregnancy? That is heparin. Which of the following is used in overdose of oral anticoagulants? That is vitamin K1. Which of the following is used in acute iron poisoning? That is desferoxamine. Neurogenic diabetes insipidus is treated by desmopressin. Drug of choice for lithium-induced nephrogenic diabetes insipidus is amiloride. Coronary steal phenomenon is shown by which anti-anginal drug? That is dipyridamole. Novel anti-anginal drug acts by non-hemodynamic mechanism is. So you tell me the answer for this. Which of the following drug reduce both preload and afterload in congestive heart failure patients? That is amrinone. Popular antiarrhythmic in intensive care unit is lidocaine. Drotaverine acts on phosphodiesterase E4. Specific side effects of nitrates is throbbing headache. Which of the following nitrate is used in treatment of cyanide poisoning? Sodium nitrite. Which of the following anti-anginal drug decreases insulin release? That is nifedipine. First dose effect is shown by prazosin. Which drug is used in treatment of cyclosporine-induced hypertension? That is CCBs. Which drug shows coronary steal phenomenon? Dipyridamole. Which of the following is PFOX inhibitor? Both trimetazidine and ranolazine. Which of the following drug is used in therapy of myocardial infarction? Both streptokinase and aspirin. Antihypertensive of choice during pregnancy is methyl-dopa. Labetalol acts through both alpha and beta receptors. Other than hypertension, potassium channel openers are also used in treatment of insulinoma, erectile dysfunction, and premature labor. Which one of these is a high selling diuretic agent? That is ethacrynic acid. Mercurial diuretics are not commonly used because of their nephrotoxicity and hepatotoxicity. Pseudolymphoma is a side effect of treatment with phenytoin. Drugs significantly affected by enzyme induction include the following except barbiturates. In the treatment of acute intermittent porphyria, drugs that may be safely used include diazepam for sedation. Which of the following is mainly an anxiolytic drug? That is diazepam. Which of the following classes of drugs will induce sleep with the fewest deviations from a physiological sleep pattern? That is benzodiazepines. Lithium carbonate is considered to be specific therapy for manic depressive psychosis. Zero order kinetics is seen in all except barbiturates. Which of the following drugs can produce galactorrhea by interfering with neuronal transmission in brain? Chlorpromazine. Which newer antidepressant may cause extrapyramidal syndrome and tardive dyskinesia? That is amoxapine. Which of the following is useful in the prophylaxis of migraine? Fluoxetine. Drug of choice in status epilepticus in children is diazepam. The only contraindication of pentaerythritol tetranitrate is acute myocardial infarction. Papaverine is used primarily for its ability to produce vasodilatation. An active metabolite of an anticonvulsant primidone is phenobarbital. Use of which of the following may be associated with significant anticholinergic side effect, that is amitriptyline. Gingival hyperplasia is a common side effect associated with prolonged treatment with phenytoin. Drug of choice in juvenile chronic arthritis is in children is aspirin. IV fluphenazine decanoate is a prodrug or drug of choice in simple schizophrenia. Bromoergocriptine is found useful in all but one of the following conditions, that is cardiac arrhythmia. Bromocriptine is partial agonist of dopamine, is a partial antagonist of dopamine, and it is used in the treatment of Parkinson's disease. Which of the following muscle relaxant is more hepatotoxic? Dantrolene. Lactulose is disaccharide of fructose and lactose, not absorbed from intestine and retains water and reduces blood ammonia in hepatic coma. Quinodiol acts by inhibiting cholesterol synthesis by liver and promoting micellar solubilization of cholesterol. Which of the following is most effective in inhibiting gastric acid secretion? That is omeprazole. Carbendazolone sodium acts by reducing, neutralizing gastric acid and augmenting mucus production. Bromocriptine is, this has done, is done. Infantile myoclonus is best treated with clonazepam. Chemotherapeutic agent used in Wilms tumor is actinomycin. Which of the following is not an alkylating agent? That is cytarabine. Leukoencephalopathy is seen with the use of vincristine. Cardiotoxicity is a limiting factor in the use of doxorubicin. Mitosis arrest in metaphase is seen with colchicine. 5-fluorouracil is the chemotherapeutic agent of choice in the following except pancreas. Which one is not an alkylating agent? Mercaptopurine. An antimetabolite which undergoes biotransformation to form an inhibitor of DNA polymerase is cytosine arabinose. The folic acid antagonist immunosuppressant drug is methotrexate. The folic acid antagonist immunosuppressant drug is methotrexate. Which anti-malignancy drug is most nephrotoxic? Cisplatin. Anti-cancer drug which crosses the blood-brain barrier is nitrosoureas. An example of pyrimidine antagonist is 5-fluorouracil. Melphalan is drug of choice in malignancy. Drug acting on mitotic phase of cell cycle are methotrexate. Drug of choice in acute lymphatic leukemia is vincristine plus prednisone. Ototoxicity as well as nephrotoxicity is caused by gold. Which of the following does not cause bone marrow suppression? Cisplatin. Morphine is not recommended to be used in head injury because it raises intracranial pressure and it causes respiratory depression. Morphine decreases cuff center and vasomotor center. Peripheral neuropathies are frequently observed following administration of vincristine. Morphine causes vasodilatation due to depression of vasomotor center and release of histamine. Ondansetron is used as antiemetic for radiation therapy induced vomiting and cancer chemotherapy induced vomiting. Which of the following purgative is an anionic detergent, that is dioctyl sulfosuccinate? Which of the following is used in the treatment of ulcerative colitis? Mesalazine, sulfasalazine, and olsalazine. Thiazide diuretics may precipitate digitalis toxicity by producing hypokalemia. Indomethacin reduces the diuretic action of furosemide by retaining sodium and water and inhibiting intrarenal synthesis of vasodilated prostaglandins. Carbonyl iron is an organic form of iron. Which of the following antidiabetic may result in resumption of ovulation in premenopausal and ovulatory women? Glimepiride. Cyanocobalamin is vitamin. A source of anticarcinogenic